insurance costs rising and the Affordable Care Act hanging in the balance, some here in PA are asking, what's going on with my coverage and will I be able to afford it?
Yeah, today Dr. Natalie Gentili joins us to explain what's happening right now, why insurance doesn't always equal assurance, and what alternative options are out there. I don't know much about this, so I'm so interested to hear, because it sounds a little confusing, but also it sounds like some people might be in trouble.
Oh, certainly. People are really running into a lot of trouble with this and have a lot of questions.
Yeah, and so let's talk about where we stand now with the news. So the end of this year, we don't really know what's going to happen next with the Affordable Care Act, the subsidies with this.
Right, and so people are expecting that in 2026, their insurance premiums, aka that amount you pay each month for your insurance, is going to increase substantially, to the point where a lot of people are going to have that choice of, can I afford this, or am I going to go completely uninsured?
Wow. So why does having insurance doesn't always equal assurance? So what do you mean by that?
Yeah, so health insurance, I think people automatically think that makes you healthier. That means you're going to have access to care. That's not always that, right? Like, you're not always going to have health assurance just because you're insured. Because what happens is people still pay for their health care. They're paying co-pays. There are a lot of hidden fees that people aren't able to plan for. And the other big issue we have in our country is access. So just because you have health insurance doesn't mean you can access a doc in a readily available way, right? You see people waiting 6 to 12 months to get in.
Right. If they're out of network, if they're in network, if you're paying the right amount, if you're with the right plan. There's so much that goes into this. And one of the other big issues too is being underinsured. So you might be paying for a plan, but it's not going to cover all of the things you might need.
Sure. So you could have a really, what we call catastrophic plan, or a really high deductible plan that you're never going to meet throughout that year. So you're paying out of pocket up to that point. Okay, so you're likely not going to engage in care as much if you can't afford that. And then if you have another way that you can be underinsured is you may have doctors that you've seen regularly, but because of this new insurance plan you can't go to them anymore because they don't play well in the sandbox together. That's underinsured then.
You know, I feel like we had this sweet spot for maybe a little while, although people were still paying a lot out of pocket for insurance, but people were seeing their doctors regularly. I mean, I remember 10, 15 years ago when we were seeing astronomically high bills that were coming in, hospital bills that people were paying.
Like, there's always medical bills. No matter if you have insurance, there's always medical bills to pay.
Are we kind of heading back in that direction where we're going to see people either not choosing to get coverage or winding up with these, these things that could bankrupt them?
I'm afraid so. I mean, medical debt is a public health crisis that I think a lot of people don't talk about enough. And what we're going to continue to see is, in an already overrun healthcare system, if people are avoiding health insurance coverage, right, then we're going to have health insurance for a much sicker pool of people, because the healthy people are going to opt out. You're going to have people who are going to seek primary care through the emergency department, which is not the correct utilization of that, right? And so you're going to have really expensive cost of care that could have just been done on the front lines of medicine if it were appropriately covered and we had a system that was actually working.
And also overrunning then our emergency departments and our healthcare workers too.
Correct.
Yeah.
So what kind of alternatives are out there?
Yeah, so we, as a direct primary care doc, so I have a primary care practice where patients pay a monthly membership. I have a lot of uninsured and underinsured patients,
I just saw your video that you posted, and I was really into it. I was trying to understand it, and it's fascinating.
Yeah, I mean, people are paying a lot of money for their primary care, and people are paying a lot of money for labs and medications, when in reality, if you self-paid for that, the discounted pricing on that is very affordable. And so a lot of people are reaching out to us now more than ever, actually for our direct primary care type model, because they want a doc that they can access, have a great amount of time with, and a relationship with. And that pairs really well with that high deductible plan for those catastrophic things that we can't really plan for.
And I want to talk about what we can't plan for, because I think that people need to be asking the right questions right now. So what should they be asking? What should they be looking at right now?
Using health insurance for your primary care is like using car insurance for your oil changes, right? Like, we don't do that. So primary care in and of itself should be separate. These catastrophic things are really expensive treatments, like cancer treatments, for example, surgeries that you need, emergency department visits. These are things that are extremely expensive, and insurance can be helpful for. It needs to stay out of primary care, though.
Yeah. Okay. Really interesting stuff. Thank you so much, Dr. Gentili. A lot more coming down the line from this, but thank you for this conversation. And if you are interested in learning more about direct care physicians of Pittsburgh or Rebel Wellness, you can head to our website, kdka.com/talkpittsburgh.
And we'll be right back with a look at tomorrow's show next.